Getting into blockchain was a big leap for me, and then listening to some of the pitches, I started to question myself. But being here today reminded me and re-inspired me as to why I got into blockchain and the application for healthcare. I want to also say a few things about what I heard earlier today. Dr. Naveen's contradictory or controversial point of view, totally agree with it. Almost everything you said, I was nodding my head, hoping you won't fall off. Listening to Mark, my goodness, you feel like you're in a lecture of psychology and humanity all combined together. But there's been such great presentations, so thank you already for everyone participating. Without further ado, let me talk about healthcare, but let me actually talk about why I'm here. So I've spent my whole life in healthcare IT. I started my first IT company when I was in college, literally in a dorm room in the US, and stayed in healthcare forever. I've had the privilege of working for 3 presidents, President Bush, President Obama, and our current president, working on healthcare for them. So I've worked on Bush Care, Obama Care, and I don't care model of care. But right now I work for a 3-year-old, and that's my son. So very personal story. I was insurance company CIO, healthcare company CEO. This is not my first gig. But about a year ago, my 2-year-old then got diagnosed with some behavioral and growth issues. And with all my access to healthcare and inside knowledge and dial-up connections to big hospitals and insurance companies, my wife does nothing but coordinate his care. That's all we do. We have one parent just coordinating his care for the last year, between speech therapy and behavioral therapy and occupational therapy and all those things. And I started to wonder, with all my resources and knowledge and contacts, if this is this hard, how does an average person deal with it? And the answer is they don't. It's really, really difficult. So I left my very comfortable perch and jumped into a whole new adventure called Solve.Care. If I can figure out the technology of using this, I'll just be manual. So a little bit about what brought me here. US spends $3.2 trillion a year in healthcare. That's $3,200 billion a year. When you do the math, it's almost $10 billion a day. And it is about 20% of our GDP. This is where the money goes. About $1 trillion goes to healthcare in hospitals, and about $500 billion goes to physicians. And after that, who knows? The graph does not tell you the story. It is an incredible expense. This is what a typical payment cycle in the US looks like, and this is not just the US. You start with eligibility checking, then check for copay, you look for cost sharing, you deliver services, you verify services are delivered, you collect all the records, you verify medical necessity, you verify payments, you verify cost sharing, you reimburse, you review, you collect. Typical payment cycle in healthcare is 97 days from the day you receive service, and I know that because I was an insurance company CIO, and I was responsible for measuring that number. And we thought we were doing pretty darn good at 97 days. Sometimes it takes 180. This is why it's so complicated. Insurance companies are big bad guys, right? We deny care to people, we deny payment to doctors. How could this industry even exist? There's a reason why it is needed. It's a governance element. What somebody has to do is to ensure that the right service is being delivered to the right person for the right reason at the right cost, and the right person is getting paid for that service. That function doesn't happen by itself. Somebody has to do it. Somebody has to verify eligibility for service. Somebody has to verify service was actually delivered. Somebody has to verify that the pricing for the service is accurate and appropriate. Somebody has to verify that all the cost-sharing elements are indeed applied. If somebody's going to subsidize part of care or part of pharmaceutical, those subsidies are properly given. Somebody has to deal with volume discount, whether it's utilization or product discounts. Somebody has to deal with exceptions of care and allow exceptions to happen. And somebody has to deal with the fact that payments are multi-party, meaning it's not just A to B paying, it's A, B, and C paying D. So these are very complex issues in healthcare that are not just the US, but also the world. Very close friend of mine, President Bush's economic advisor for healthcare, he published a study about a month ago. And you can use the word NHS, by the way, instead of Medicaid, same idea. Medicaid is a program in the US for providing health care to the poor. If you make less than $15,000 a year, government pays for all your health care. It costs about $550 billion a year to run this program around the country, and we believe and factually have demonstrated over $100 billion is inefficient or fraud or waste or overutilization, meaning 20% of this program is simply spent on stuff that doesn't help anyone. And that number is growing. It's an astounding number. That's just one program. Then we have Medicare, CHIP, SNAP, TANF, TRICARE. There are more acronyms than I can remember and you will ever understand. But $3.5 trillion, and if 20% is being wasted, we're talking about almost $1 trillion a year in unneeded expense. That's the math we're dealing with. So how did I get involved with this? Coming from the insurance company side, the biggest question for me always is, how do I make sure that the right person is getting the right service for the right reason at the right time from the right person and at the right cost? And it all boils down to transparency and accountability. And that's why blockchain makes sense. Somebody earlier was asking me, why blockchain? Why not COBOL or Java or cloud? What's the technological reason why you're excited? And I'm not really excited about blockchain, really. I'm really excited by the fact that you have the ability to balance transparency and accountability. And that's really what is the promise of distributed ledger technology or blockchain or whatever the new acronym will be in a year. It'll probably be different. So what we decided to do was to attack the problem from the fundamental issues. How do I keep all the parties in sync? So care coordination or care delivery is complex. We can talk about integrated delivery networks. So we can say, what if everybody just worked for us? Everybody just went to the same hospital. We had this mega hospital, and all the doctors, nurses, lab, pharmacy were all aligned. Imagine how complex that hospital would be. It would be no different than NHS. It would just be a mega, mega, mega care delivery organization with all the same coordination problems as you have today. So people think of utopia as a vertically integrated delivery network would solve all my issues, and it doesn't. It simply creates a microcosm of those issues, puts a thin layer of it on it, calls it a new label, and then you're expected it'll automatically work. It doesn't. So no matter what your delivery model is, whether you are a single-payer country like UK or a multi-payer country like US or a direct pay model like India or a fully decentralized healthcare like China, you still have the same three issues. How do I get the care to the right person at the right quality for the right outcome? So that's care delivery. How do I make sure the care was delivered at the right cost? And how do I make it easy for the user to use the care? If you make the system so difficult they can't use it, doesn't matter how efficient it is. It's not going to serve the purpose. So those three objectives is what we are trying to solve in our platform. I'm not really here to talk about the platform. I'm just trying to give you an idea. So when I was listening to everybody talk earlier today, I was thinking, yep, we could use their technology. Yep, we could call IOTA up and say, hey guys, show us your blockchain. Yep, we could call Cadre and say, you could give us interoperability between blockchains and so on. Everybody who presented here today fits in our universe of the protocol of the platform. So that's really why it's such an exciting day for me. So let's talk about how do we see this working. So one fundamental notion of blockchain that we are trying to leverage is that there can be truly a centralized ledger of events, not of content, of events. Imagine a scenario, it's a very simple one, that you as a patient have a centralized ledger where everything that happened about you, regardless of the party who delivered that service or event for you, is in an event ledger, but no content. Not your clinical record, not your drugs, not your treatment, just the fact that you went to the doctor, you got a prescription, you went to the lab, you got a test result, you went to a specialist and you shared the test results with him or you didn't share the results with him. You would have an immutable record of all events. We're not talking about integrating back-end systems. We've been down that cycle. We're not talking about point-to-point integration and interoperability. And I'm going to diverge and talk about a personal anecdote. I remember sitting in a high-level committee, healthcare committee, when Obamacare was being discussed in Washington. And somebody saying, if you put enough money in interoperability, they will integrate. So $30 billion was put aside for interoperability. We were going to integrate every hospital, every lab, every pharmacy, every insurance company. That money got spent. That's 7 years ago. Interoperability sucks, even worse than it was before. You know why? Because every doctor has an EMR system that doesn't talk to anything else. Every lab has another system that doesn't talk to anything else. And I'm expected to integrate thousands of systems before it used to be hundreds. So we made things worse, like politicians always do. We spent enormous amounts of money to create more silos. So that is not the answer. The answer is event coordination. In our view, what we really need to know is that something happened. And if that event is relevant to me as a care provider, then I go dig deeper. Then I seek your consent to look under the covers and say, do I have to know what happened because it's relevant to my ability to care for you? That's our fundamental premise. Don't do integration. Don't talk about another data silo. Don't talk about putting data on blockchain. Simply put events on blockchain, create a coordination framework, and let everybody coordinate, those who need to know. And yes, you don't need to put it out on the World Wide Web where anybody in China is mining your events, but maybe you do. So you can actually compare the quality of diabetic care in Boston with Botswana. You could do that without compromising your safety or your security because you're only talking about events being coordinated. So that's our fundamental vision behind Solve.Care platform, in my view, that we can use blockchain intelligently and we can actually start to change care delivery around the world. One other thing I want to talk about, this slide actually I haven't touched upon. Imagine now this ledger has access for certain people. And now you want someone like a miner to mine this ledger to see, is your care sequence the right sequence? Or is it even conforming with similar care sequences out there? There are three types of healthcare issues, right? There is either episodic, something happened, you didn't expect it, you need care. Or it's preventative, you want to prevent being sick. Or it's chronic, you have a disease, you got to deal with it. All three have different care models. Episodic, you need information right then and there. Chronic, you have the ability to retroactively and probabilistically look ahead, see what probability of disease and what probability of outcome you have. And then you have the preventative and then chronic. So they are very similar in the regard that you are either dealing with a very short window of care like episode is, or a long duration of care like a chronic disease is. They can be coordinated very differently, and they should be coordinated differently. You cannot treat a trauma center the same way as you would treat somebody who's trying to lose weight, right? Very different sense of urgency. Different type of data is needed, a different modality. So what we are talking about is using this event ledger to mine information and create proof of service, proof of quality, proof of outcome as computational scores that you can compare empirically between people. It's true that my genetics are different than many of you in the room. I'm predisposed to diabetes, you probably aren't. But that doesn't mean that my treatment in a chronic diabetic condition is going to be that different than somebody of a similar age and similar ethnicity living in the United States or in the Western world. So you can compare. We are very individualized, and health is very local and personal, but there are ways to aggregate and compare data. So our vision is three things. Coordinate care better through a shared event log, measure quality of care through a shared event log, and enforce accountability through a shared event log. But do not put sensitive data on it. Manage access to the data through a consent log that's part of your event log. Does that make sense? Consent, not automatic distribution. I don't want my clinical records on the blockchain for everybody to mine, but I do want to be able to say, I gave consent to Naveen to treat me, and that consent stays on and cannot be revoked, because then I introduce liability that is not fair. So that's what we are after. We also have introduced an idea of a currency that understands consent and events in healthcare. So our vision is that fiat currencies are dumb. They don't understand why they're being transferred. They simply accept the transfer through ownership. When you pay somebody $1, it doesn't ask you the question, why are you paying me? Why am I going to this person's pocket? But an intelligent healthcare currency should. It should ask the question, what are you paying for? Are you paying the right amount? Are you paying the right person? Have you received the treatment? Have you gotten the outcome? What component of me should be fixed cost? What component of me should be quality care or performance-based? So when we talk about an intelligent currency, which is part of our vision and platform, it is about currency that enforces the care protocol or the care outcomes to the degree the healthcare system allows for. So we designed a currency, and this is really for you all to exploit as you see fit, a currency that has the ability to compute a proof of service score based on the public event ledger, the ability to reconcile and adjust automatically if you end up delivering poor quality of care and I end up being readmitted to the hospital 3 times. Perhaps there's an escrow element to quality of payment. There is the ability to manage consents so that you are only going to pay for things for which you have consented. There is the ability to replay entire chain of events that happened without actually sharing the private data around exactly how did you get treat me or how did I get my benefits. And it can be programmable in the sense that you can program it for UK NHS model, which is single payer, or a US model, which is third-party payment model. So we decided to announce our 7 missions for launching a platform in healthcare. First is decentralized healthcare and benefit administration. I want to put myself out of business. As an insurance CIO, I had a huge IT budget for a major insurance company, and I saw myself just repeating myself. I would build a system, and then 5 years later, I'll replace it with another system. It'll be IBM one day, Oracle the other, but never really changing what I do. So blockchain, when properly applied, does give us the ability to decentralize. Do I really need to own a system to adjudicate claims? Not really. I could have a farm of nodes compute the claim for me and give me a score and say, pay it, Pradeep. It's $35 claim. Your proof of service is 97%. Why are you going to waste time computing this? Send it out, make the payment. This is a $10,000 claim. Proof of service is 52%. Stop. Something doesn't add up. Services are too high. Price is too high. So I can decentralize my core systems. When you do that, I can spend more money on the call center to take care of the consumer calling in. I can pay better to the providers. I can eliminate my huge fixed costs. There's a huge implication when you redirect insurance dollars away from administrative to actual care delivery. So that's our vision. Reduce non-care costs by 90%, meaning I shouldn't have to have the kind of non-medical spend ratio that I have today, which is 12 to 14% of my total budget is on non-medical expense. Let's cut it down to 1 or 2% if we can. Engage the patient, put them in the center of the blockchain. It's your blockchain, it's your record, you can control it, you give consent. I'm simply a subscriber. I tune into your channel. I don't control the channel anymore. Reduce the administrative burden on the doctors. This is fundamental. Liability and risk. You asked this question earlier, liability and risk. There are 3 kinds of fundamental risk. I as a patient have care risk. You as a doctor have risk of giving me care and being sued for it. And I as an insurer have a risk of paying too much or too little and then getting sued for that. Those are 3 fundamental risks of healthcare. There are more, but those are foundational risks. We can address all 3 of them. If you as an insurance company can publish eligibility data to me to share with Naveen without needing to be in the middle and it's verifiable truth, there's no liability anymore. He's not liable to lose payment. I'm not liable to not receive care, and the insurance company doesn't get sued. So there is a tremendous reduction in risk when you make the right data relevant, actionable, available, and relevant. That doesn't always mean clinical data. I'm talking about administrative data. Okay? Last is accurate and timely payments. It would be wonderful if I could actually adjudicate a claim when the moment a patient leaves the doctor's office and tell the doctor, I'm going to pay you $93. Right now it takes me a month, sometimes 3 months to figure it out. And here is a fact. If a claim is under $35, I'm better off paying it than adjudicating it because cost of adjudication is $39. Imagine the scenario anywhere else in any other industry. You go to buy a sweater and the cost of swiping the credit card is more than the sweater itself. Would you buy it? You won't. You'd be like, what the heck? I'll pay cash. But in healthcare, the cost of paying a claim to the doctor can be greater than the claim itself. Happens all the time. So either you pay it blindly, thereby you foster fraud, or you spend twice the money. Both are the unacceptable outcomes. So if we can do real-time proof of service computation in a blockchain, you can pay the claim instantly. Make fraud, waste, and abuse go away. This is really important. We hear about fraud, waste. I know Genevieve talked about fraud earlier in the US. Here is 3 different ways fraud happens. Either I get billed for services that weren't delivered, or I get billed for services that were not needed, or I get billed too much for services that were needed and delivered. That's it. Fundamental 3 foundational fraud constructs. How do you get rid of them? Well, you get rid of them by computing that the service was needed, was delivered, and was priced correctly. And that's the entire purpose of an insurance company. I mean, that's it. That's why we exist. That's why we have those fancy buildings and thousands of people in call center. But if you can put in a transparent ledger that I give consent for others to mine, I practically can do everything that I want to do but never have the time or money to do. Finally, transparency and accountability entire life cycle. We've heard a lot about AI replacing medicine or giving doctors advice or overriding doctors. No. It's not about that. We're far away from having a computer manage our care for us from a clinical point of view. But here is the question. What if the doctor is wrong? What if they simply don't have all the right information? Problem one. What if they don't have the right training? Problem two. What if they're distracted or busy or simply made a human error, because we are all human and we are flawed? So how do I get to validate as a patient that what I'm being treated is indeed, at least generally speaking, the right way? You are expected to believe your doctor, and I do. But how do I validate? Trust but inspect? Where is my inspection? I have none today. You can go get a second opinion. How hard is that? Try to collect all the records together and go find a second doctor who will even talk to you? Goodness, that's not going to happen. And you are too sick to do that anyway. So having a transparent ledger where somebody can compute my quality of care score and just have someone else look at it and say, yeah, this is pretty reasonable. Within boundary, this is not off the charts. You are in the median here. Gives me tremendous comfort as a patient to enforce accountability on my doctor. The reverse is true too. If I haven't filled my prescription, a pharmacy event isn't in my record, then my doctor can say, Pradeep, why are you wasting my time? You show up, you complain, I prescribe you medicine, you never take it. So I have those accountability goes both ways. So our objective of Solve.Care platform is really to allow bilateral accountability, not who's going to hammer whom, who's going to force whom to change, but rather who's going to make information transparent so we can all really know where we stand. So I'm going to summarize with one statement. My vision is that if we can achieve accountability through transparency and proper use of information that I control the usage of, then healthcare can be and will be transformed. And that's the vision that led me to leave my perch in a big building, in a big office, and start this company. And because I work for a 3-year-old whose care coordination is fiendishly difficult. Thank you, everyone.